NCDs in Kenya are becoming a growing concern. We are now talking about a mortality rate of 41%. That is up from 39% in 2019. And when you go to a hospital right now, 50% of those who are admitted are likely to be due to an NCD. In order to move the needle for NCDs, the basic ingredient is health financing. Because when you have health financing is when you can make anything else possible, such that like the capacity building of the health workers. That's when you can be able to buy for the population medicines or at least make them accessible. That's when you can be able to have data systems to monitor and evaluate the disease burden. So without financing, it will be very difficult to do these things. But I have to say health financing is not the only ingredient required to move or to reduce the burden of NCDs. It has to occur within sound structures that are able to integrate the voices of community, structures that are able to communicate between national and subnational entities, structures that also make it conducive for other public-private partnerships to occur. And also it has to be under a foundation where there are policies that will help you prioritize what to do with the money or how to evaluate how the money has been done. For the first time, I'm seeing greater recognition because of the political will we are having in the country. And this has translated to NCDs being integrated into the overall health agenda. For example, the first time we are talking about primary healthcare services that has to include NCDs. For the first time, we have a comprehensive health benefits package that has quite a lot of NCDs in place. Despite the shifting or dwindling donor funding, there has been more and more efforts towards coming into the NCD space. And for the first time, we have projects which would not have been funded. Now NCDs is being recognized more in the wider development agenda. As a ministry, as a division of non-communicable diseases, we are being called more to the table to discuss what can be done to prevent and manage NCDs. All this has also been made possible because we built a case for NCDs in way of developing investment cases. And we've done investment cases in mental health, in cervical cancer, in breast cancer, in diabetes and hypertension. This we have disseminated to some of our lawmakers and our policymakers, and they've understood the great benefit of having more increased investments in NCDs. So this has translated to more money domestically and also externally. One of the things that keeps me hopeful is hearing the voices of people living with NCDs, especially their feedback on things that we're implementing. Specifically in Kenya, we are undergoing some reforms that has changed the insurance landscape in the country. So such stories of success with the reforms that we are undergoing keeps me hopeful that things will be better in the greater space. And just the fact that people are coalescing to discuss about financing and the potential funders are really laying down some concrete avenues for financing also gives me hope that the future will be better as far as NCD financing is concerned.